like I said, we'll just go through three different, I made up three different case studies. So I'll have you guys interact and answer the questions, okay? Oh, hang on. Share the wrong one here. Okay. You guys see that okay? Yes?
Yeah, I see it.
Okay, thank you. So first case study, I'll read it to you guys. So 10-year-old female who's 32 kilos. Mom is bringing her in for excessive thirst, frequent urination, fatigue, abdominal pain, and vomiting for the last 3 days. She developed increased thirst and urination about 2 weeks ago. Over the last 3 days, she became progressively lethargic and complained of abdominal pain. She experienced multiple episodes of vomiting and decreased oral intake. On the day of admission, the mom noticed rapid breathing and brought her to the ER. So she has no previous diagnosis of diabetes, and her immunizations are up to date and no known drug allergies. Okay. All right, here are your assessment findings. Temperature is normal, right? Heart rate, is that a normal heart rate for a 10-year-old?
No,
No, it's what is it? Is it fast, slow? A heart,
it's fast.
yeah, a heart rate of 132 is fast for a 10-year-old, right? What about respiratory rate?
It's also fast as well.
Yes. Okay, guys, I want you all to be sharing, not just Julissa. Okay. Okay, so your physical exams, you find dry mucous membranes, delayed capillary refill, sunken eyes, lethargic but responsive, deep rapid respirations or Kussmaul's breathing, fruity breath, okay, and mild abdominal tenderness. Okay, your diagnostic results. So you're looking at your blood glucose level. It's way high, 560. They're acidotic, 7.12. Your bicarbs low, positive ketones and urine ketones. Okay. And our hemoglobin A1C is 11.2 and normal is less than 5.7. Okay, so what's your diagnosis for this kiddo?
DKA.
What?
DKA.
Yeah. And usually in kids, what's the most common type? Like
Type 1.
Yeah. Good. So yeah, type 1, new onset DKA. Good. Okay, so what's your pathophys of DKA? What happens?
High blood sugar level.
Why does the blood sugar go high? What's not working in DKA or
Pancreas.
type 1? Sorry, Brandy, I heard you for a second, then I didn't hear you.
Pancreas.
Yeah, the pancreas. What is the pancreas release that helps manage the glucose?
The
Insulin.
Insulin, right. So DKA happens when there's not enough insulin to break down the glucose to prevent it from entering the cells. Okay. So then instead of breaking down the glucose, it breaks down the fat. And then that's where you get the ketones accumulating, causing a metabolic acidosis. Okay. The longer time period that they have hyperglycemia, this then leads to dehydration and electrolyte imbalances and potentially cerebral edema, which is where you see like the symptoms of like confusion and lethargy, right? Okay. So what's your medical management? Oh, sorry.
IV, insulin, and fluids.
Yes. Good. So IV, what are you going to do for fluids? What type of fluid are you going to give them?
Would it be isotonic or no?
Normal
Yeah.
saline.
What would be an isotonic solution? Someone said
Would
in
it be
the chat.
lactated winners?
0.9 normal saline.
0.9%
Normal
normal saline.
Normal saline. 0.9%, just regular old normal saline. Okay. That's what you're going to use for fluid resuscitation. Yes, LR is used sometimes, but not in cases with DKA patients. Okay. Kids also going to be on continuous IV insulin. Okay. What else are you going to be doing? If they're on fluids and they're on continuous insulin, what should you be monitoring?
Potassium. And blood
What else?
sugar.
Yeah,
Blood
the
sugar.
glucose. What, as far as electrolytes, what electrolytes might you need to be replacing?
Sodium and potassium.
Yeah, someone said monitor potassium, but you might be having to give them potassium, right? Depending on if it's going high or low or, okay. Magnesium sometimes too. Okay. What else are you going to be doing with your assessments? Of the patient?
Neuro checks.
Perfect. Good. Yep. Yep. Neuro assessments because you're watching for that cerebral edema, right? Good. When do you know that you can, when can you start them on just regular sub-Q insulin?
Is it when the insulin gets to 200?
Yeah, so when they're no longer in DKA, right? Yep. So when their level comes down low enough that they're no longer in DKA, they're not dropping those ketones in their urine and all of that. Okay. And different places have different protocols, like your blood glucose might have to be 180 one place, and another place it might be okay at 200. So, but essentially, when they're no longer in DKA is when you're good to transition. Okay, with a kiddo who's in DKA, what are some nursing diagnoses that would apply? Shout them out.
Urinalysis.
For a nursing diagnosis?
Oh, my bad.
Deficient fluid
you're okay.
volume.
Deficient fluid volume. Okay. How would you have evidence, or what would that be related to, I guess?
The diuresis from the hyperglycemia.
Right. And then what's your evidence?
They had dry mucous membranes, polyuria, skin turgor,
Yeah. What about their heart rate if they're dry?
tacky.
Yep. Good. Delayed cap refill, right? Because we had that on this patient.
Increased
Their
thirst.
Yep, their blood pressure was a little low. Yep, good. So what would be your goal to counteract the deficient fluid volume? Or what would be your intervention, I guess? Fluids, right?
Giving them
Normal
fluid.
saline. Yeah.
Yeah.
Yep, giving them fluids. Okay. Now, obviously, if you have a kiddo who's dehydrated, you're going to be looking at their IV site because they're going to be getting fluids. Okay, you're going to be monitoring eyes and nose, probably hourly, weights, and your lab results too. And when hydration has improved, they're going to have better urine output and their vitals are going to stable. Okay, what else? What's another priority nursing diagnosis for a kiddo who's in DKA? I've got 3 or 4 of them more that I can think of.
Ineffective breathing pattern.
Yep, that would be a good one. What's that related to?
Metabolic acidosis compensating.
Yeah, right. And in this patient, what were we seeing?
Too small respirations, ABGs, abnormalities.
Yep, and high respiratory rate, right? Good. So your goal would be to maintain effective respiratory effort and function, right? So what interventions would you do to make sure that you're maintaining effective respiratory function? What are you going to be monitoring or doing to the patient? Okay, how do we know that our patient's breathing effectively?
Respirations go down.
Yeah. So you'd be assessing that frequently. What else would you be looking at? Their oxygen saturation.
Maybe cap refill to see if the perfusion is getting back to normal.
Yeah. Yep. Good. All right. What else? For nursing diagnoses. Guys, I'm just going to start calling on people if it keeps being just me and Brandy and Julissa.
Infection and electrolyte imbalance.
Electrolyte imbalance. Yep, good. That was the big one that I was thinking of. What would the electrolyte imbalance be related to?
The diuresis.
Potassium. Diuresis, yep, and potassium, yep, could be off, right? But what else? What is causing your electrolytes potentially to be off? The diuresis,
All the insulin you're giving them.
the insulin you're giving them. Yep. Okay, so what would be your goal? To normalize their electrolytes, right? So what nursing interventions are you guys going to do to be monitoring for their risk of electrolyte imbalance?
Monitor labs.
Uh-huh.
Replace the potassium or sodium or mag, whatever needs to be replaced.
Yeah. So if you have wonky potassium, wonky sodium levels that are all over the place, what can that affect? Especially potassium. Yeah, cardiac and neuro checks, right, too. If your sodium gets low, you can start having seizures and all of that. So what would be something else that you guys could check in regards to cardiac?
You need to have them on telly.
Telly, yeah. Yep. Have them on a monitor. Good. Yep. Good. Monitoring eyes and nose. Yep. That all looks really good. Good job. I have one more here. Essentially, there are new diagnoses of type 1 diabetes. So what potentially you can use knowledge deficit for almost every new diagnosis, right? As a nursing diagnosis. So knowledge deficit of the patient and the family since they were just diagnosed with type 1 diabetes. So what would your goal be?
To assess their understanding.
Yeah, good. Teach them how to monitor their blood sugars. We're going to be teaching them signs of low and high blood sugar, right? How to give their kiddo insulin. Okay. What to do if their kiddo gets sick. That sort of thing. Okay. Any questions about DK? No? Okay. Go on to the next one. Maybe. Okay. So here's case study number 2. Okay. So an 8-month-old male, parents are reporting poor feeding, excessive sweating during feeds, failure to gain weight, rapid breathing, frequent respiratory infections. Okay, past medical history. They were diagnosed with a large VSD at age 2 months. There's a history of congestive heart failure symptoms. They're being treated with diuretics and no known allergies. Okay, so here's our vitals. For an 8-month-old, 145 for respers, 34 for, 145 for heart rate, 34 respers. Blood pressure looks okay. They're on a little oxygen. Temp is okay. Okay, here's your physical exam. They're awake but irritable. They're responding appropriately to caregivers, mild tachypnea, clear breath sounds bilaterally. Oh, they have a chest tube. Okay, minimal drainage, regular heart rhythm. They have pulses, generalized edema, mid-sternal incision. Okay, so what do you think probably has happened recently for this kiddo? They have a mid-sternal incision. They have a chest tube in still. 2 months, they were diagnosed with a VSD.
Heart surgery.
Yeah, they just had a VSD repair probably. Okay, good. Here's your labs. They look okay. Okay, so yeah, so post-op VSD. Okay, so looking at post-op VSD, what's your pathophys with a ventricular septal defect, a VSD? What is it?
It's a hole in the ventricle wall.
Yes, between the 2 ventricles, right? So before it's repaired, what's happening? What is happening to the blood?
Mixture of blood.
Yep. It's going from higher pressure, which side has higher pressure typically in the heart?
Left side.
Left, and it's pushing to the right. Then what else is happening when that's happening? When you have that shunting, some hypoxia. No, not really
Going
hypoxia.
backwards.
What? Sorry, Monica.
I said essentially, is it going backwards, like left ventricle to right ventricle?
Yeah, so it's recirculating back to the lungs, right? So you're going to have increased pulmonary blood flow. So you're not going to have hypoxia, but that's going to cause volume overload eventually, right?
Increased workload of the heart.
Right. Yep. Good. So then once they have that patch in place, then it gets rid of that shunting and ideally should improve the cardiac function overall. Okay. So what are your nursing care priorities with a post-op cardiac kid? What are you going to be watching for?
Heart rate.
Fluid and electrolyte.
Yeah. Heart rate.
Sounds.
Yeah. They have a chest tube. So what are you doing with the chest tube?
The amount of output it has, like the drainage.
Yeah,
If
and the
it's too fast
color
or too
and
slow. Yeah.
yep. Yep. What else are you looking at? They just had surgery.
Incision site.
Blood pressure.
Yep. 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 Good. And then what else? They just had surgery and they weren't gaining weight well before surgery. So you'll be
Nutrition.
wanting to monitor their growth and nutrition. Yep, good. And you'll be educating parents, right, about the post-op and kind of what to expect. Okay, what are some of your nursing diagnoses for a kiddo with cardiac, with a VSD?
Decreased cardiac output.
Yeah. Related to what?
Cardiac structure.
Yeah, the cardiac surgery and the cardiac, structure. So what would prove to you, or like what would evidence be for that on your exam, potentially?
Delayed cap refill.
Yeah, potentially.
Tachycardia.
Yep, tachycardia. Good, good. So you guys would be monitoring vitals really closely. What else would you be looking at? Cap refill, you said, Brandy. What would be
Lung
key things
sounds.
to be looking for low cardiac output? Sorry, Lorena. What did you say?
Lung sounds.
Lung sounds. Yeah, to make sure they're not getting fluid overloaded. Good. What would show you signs of like poor cardiac output? What would you see?
Jugular vein extension.
Potentially. That's hard to see sometimes though in kids, but potentially.
Arrhythmias.
Yeah, potentially.
Like fluid retention?
Sorry, what did you say?
Fluid retention?
Yes. So decreased urinary output. What will their blood pressure look like if they're having poor cardiac output? Low usually. They're going to be hypotensive and they're going to have cool extremities, right? Okay. Oops, sorry. Had a couple more here. Okay, what's another nursing diagnosis?
Acute pain.
Yes, good. That's related to they just had surgery, right? Sternotomy. Okay. What would be evidence that they're having pain in an 8-month-old?
Crying.
Mm-hmm.
Irritability.
Yes. Poor eating, all of that. Okay, good. So in an 8-month-old, what pain scale are you going to use to assess their pain? FLAC. Yep, good. Perfect. And what sort of meds or things, what interventions can you do other than assessing their pain?
Tylenol, ibuprofen.
Yeah, Tylenol, maybe ibuprofen. Sometimes post-ops, cardiac stuff, they don't necessarily want to give ibuprofen. But sometimes they will. So it just kind of depends on the surgeon. But yeah, managing their pain. Now, if you had a sternotomy, so they cut through your sternum, it's likely that you would have opiates probably while you're in the hospital. So little kids, we give them those as well. Okay. Can anyone think of another nursing diagnosis for a post-op cardiac kiddo?
Risk for bleeding and infection.
Yes, perfect. Yeah, risk for infection. They're going to have that surgical incision. They're probably also going to have like IJs or, some central lines. Okay. They're going to have chest tubes usually too. So there's a lot of potential risk for infection. What are you as the nurse going to be doing to try to prevent that?
Sterile technique.
Yeah.
With the cleaning.
Yep.
Be good hand washing.
Hand washing. Yep. What sort of signs are you looking for that would indicate infection?
Elevated temp.
Yeah. What about at the site?
Purulent drainage. Redness.
Swelling.
Redness, swelling. Good. Yeah. Good. Perfect. You could also do impaired gas exchange, right? Because post-op, after a cardiac surgery, there's going to be some pulmonary effects too. So keeping an eye on that. And then once again, knowledge deficit too. Okay. All right. Our third case study. MK is a 6-year-old male. Child's mother brought him to the emergency department with high fever, severe headache, vomiting, neck stiffness, increased sleepiness. Symptoms began approximately 24 hours before admission and worsened throughout the day. MK was healthy until the previous evening when he developed a fever of 103.1. Overnight, he complained of severe headache and vomited 3 times. The following morning, he became lethargic and refused foods and fluids. His mom noticed sensitivity to light and difficulty moving his neck. He has no chronic illnesses. His immunizations are incomplete. He has no known drug allergies, and he's had a previous episode of otitis media. Okay, here's your vitals. 106.3 or tachycardic 130, right? Respiratories are a little elevated. Blood pressure is okay. Okay, your neuro exam, lethargic but arouses. Positive Kernig's, positive Burditsky's, photophobia. Breath sounds are clear. Tachycardia, nausea, vomiting, decreased oral intake. Here's your labs. 18,000. Elevated CRP. Did a blood culture, it's positive for bacteria. They did a spinal tap. Elevated protein, decreased glucose, white blood cells in the CSF, and it's positive for bacterial pathogen. So what diagnosis are you looking at probably with this kiddo?
Meningitis.
Like bacterial meningitis.
Bacterial meningitis. Yep, good. Good. Okay, so what's our pathophys of bacterial meningitis? What's your pathophys? Meningitis. What is it?
Inflammation of the meninges.
Uh-huh. That surrounds the brain and the spinal cord, right?
Correct.
And in bacterial form, it's bacterial that then causes inflammation and increased intracranial pressure, cerebral edema, and neurological dysfunction. Okay. Good. Okay, what's your medical management of a kiddo with bacterial meningitis?
Having them in a calm, non-stimulating environment.
Yeah. What's your
What do
thought
you
on
want
that,
about
Julie? So what's the reason behind that, do you think? What are they at risk for?
Like a stroke or seizure.
Seizure. Mm-hmm.
Seizure.
Yep. Seizures. Yep. Okay. What's the number one, the first thing you're going to do with a kiddo with bacterial meningitis?
Antibiotics.
IV antibiotics. Yep. Good. What else are you going to be giving this kiddo? They have a temp of 103.8.
Tylenol.
Tylenol.
Tylenol or ibuprofen. Yep. Their blood pressure was a little low. They're a little tacky. So
Fluid
as far as
resuscitation.
little IV fluids potentially, right? Are they going to be in normal precautions, like standard precautions, or what are they going to be in?
Droplet.
Droplet.
Droplets. Yep. And you're going to be giving them Tylenol and ibuprofen too to kind of help with their headaches as well. Good. All right. What's some of your nursing diagnoses for a kiddo who has bacterial meningitis? Scarlett, did you say something? Sorry.
No,
No?
not yet.
You don't have a guess of what a priority nursing diagnosis for meningitis would be?
Or like the lumbar puncture?
Potentially, right? What would that cause potentially?
What would it cause?
Yeah, or what would you
Oh,
monitor?
to decrease, like pull out the
You're checking that
inflammation,
to just look at their CSF, but you're tapping right into their spinal area. So what would be a concern?
Weaken of the CSF.
Infection, right?
no?
At that
Increase
site.
increase intracranial pressure.
Yes. Uh-huh. Good. Okay. So how about hypothermia?
Mm.
Hyperthermia? Because they have an infection. And in this patient, they were febrile and had flushed appearance and they were tachycardic. So you'd be monitoring their temperature regularly, doing cooling measures if you needed to, and continuing monitoring them for infection. What else? What's another nursing diagnosis?
Neurotex?
Sorry. I heard two people say something.
The neurochecks, right? It's like
Well, that would be an intervention. So what would be your nursing diagnosis?
Acute confusion.
like failure to thrive or something. That's what you're talking about, right?
No, I'm thinking of a specific neurologic one. So ineffective cerebral tissue perfusion. Okay. And then that you would be doing neuro checks. Okay. Let's see, I've got a couple. What else? What else are you seeing? They're vomiting and have dry mucous membranes, a poor oral intake. What's another nursing diagnosis you could potentially see?
Dehydration.
Immune system.
Deficient fluid volume, right? Good. So monitoring
Electrolyte imbalance.
status. Yeah, electrolyte imbalance. Yep. Good. Good. What about pain? Right? They're having that severe headache and the neck stiffness. So what would you do for their pain?
Decrease the stimulation.
Yeah. Good. What else can you do for their pain?
Meds.
Yeah. Right. Encourage resting. Good. Monitoring their response to the meds, see if it's helpful or not. Good. All right. Well, that's all I've got for you guys. Those are the top 3 kind of topics that I saw.